All right, Matty, we'll leave it at that. Thanks very much for joining us in these discussions. And viewers, we're now going to proceed to cover some news from Africa. Now, medical charity group Médecins Sans Frontières has warned that it may soon struggle to provide care in remote areas of South Sudan as medical supplies run low. The organization says that many of its facilities in conflict-affected regions cannot be restocked due to security concerns, putting thousands of vulnerable people at risk. National staff continue to operate these hospitals, but MSF cautions that without regular supply deliveries, essential treatments could soon stop. The MSF group employs around 4,000 local staff who remain the backbone of its operations, ensuring services continue where international teams cannot enter. Let's now listen to what an MSF representative working in South Sudan has said on the ongoing medical supply crisis.
We are operating what is called on remote in the area where we cannot access. But the problem is that we cannot resupply our hospital. So once the stock will be over, if we have no access and if we are not able to provide new supply, medical supply there, then it will be very difficult. So far, we succeeded to cope with what we have. It's something like 4,000 national staff in the country, in South Sudan. Means we still have people who are MSF, who are under contract and under our responsibility, operating there. So it's not only 5, 6, 10 international staff going to run a project, it's a full team, including South Sudanese running hospital and collaborating with the Ministry of Health to run some facilities. So we still can continue so far, but then it's very difficult to predict how long we will be able to continue our activity.
Meanwhile, South Sudanese authorities say that they are not interfering with humanitarian work and encourage civilians in insecure areas to move to safer locations. Whereas South Sudan's president has also fired 2 aides after an appointment scandal. And remember, this after South Sudan hospital was hit by government airstrikes, which is also what the MSF says. Aid workers are finding it difficult now to supply resources to hospitals. And let me now, in fact, welcome Ayanuga Olugbenga Paul, Public Affairs Analyst in this discussion. He joins us from Lagos in Nigeria. Ayanuga, thanks very much for joining us. Firstly, how bad is the situation there? Hospitals have also been struck in South Sudan, making it difficult for, working groups like MSF to provide aid and supplies.
Yes, I mean, the situation in South Sudan is very there. Even before this recent strike, you know, MSF, UN aids have already been warning of acute shortage in supply, that they could not be able to meet up the demand needs of the refugee and displaced people in that country if they do not get any support in form of grants and goodwill support from both individuals and governments across the world. And I think it is that their prediction and call that have been persistent for the last 3 months that is now manifesting, because many of their supply storage have been drained to its most minimal level. That, I mean, like about 2 months ago, around early December, both UN aids and some, I think Red Cross were talking about how before they could attend to about 1.5 million people, but they only have a facility to attend to less than 600,000, and that itself is dwindling fast. And now, I mean, we are in February, so you can imagine what would have happened, coupled now with the strikes and blockades by the militant groups that are making the journey more treacherous for some of these aid organizations to reach those who are in dire need of these medical supplies and other humanitarian aids that are not enough in the first place to begin with. So the situation is really very terrible And if indeed the government of Sudan wants to care about the people, they need to look for a way to have a truce that will open some of this humanitarian corridor and also assist in supplying humanitarian supplies to some of these organizations to get it to the people in need.
Yeah, Ayanuga, are there also any fresh details coming in as far as the missing MSF aid workers were concerned? Aid workers were missing after the airstrikes in the hospitals there.
There is no update yet on the situation with the aid workers that are missing. And you know that these are usually the first responders that would have helped in locating or rescuing other people. Now that they are caught in the crossfire, there is hardly any means of getting across to them, and the people they are there to help are also incapacitated in calling for help, in terms of getting even basic things as internet to get information out and say we need help in so place and so on. So there is no further information at the moment, but we are still following and hoping they will be rescued.
Right, Ayanuga, thanks very much then for joining me with all that latest information. And viewers, let's now proceed to cover some more